Good morning and welcome to the 77th annual meeting of the Association of American Physicians and Surgeons. I'm zooming to you from the banks of the San Antonio River, a short walk from the Alamo and the historic Menger Hotel where an in-person version of this meeting had been planned. As I was laboring over this message 3 days ago, my daughter, also a physician, was engaged in another form of active labor. But under COVID-19 constraints, she labored alone without her family there to support her. This is the year that tries our souls. I lost my father-in-law in June. He generally declined of a broken heart of sorts, isolated from his family in his final days, and a beautiful high school and college friend in August who took her own life in despair. A long-suffering family member has been in the ICU twice in September, relapsing and nearly dying from overdose and abuse. Cancer patients are putting off follow-up care, including me, and that's just me, one of 330 million American lives. We, the patients and physicians of America, have allowed a virus to control and for many destroy our lives. We've been engaged in a battle for the soul of healthcare since the day of the ancient Greek philosopher Plato, who urged that doctors refrain from curing the weak and infirm to improve society, versus his contemporary Hippocrates, who felt that physicians work on behalf of the patient, not for the good of the state. But this goes further. We've been engaged in a long retreat at the hand of government since two major legislative errors. First, wartime wage controls of the World War II Stabilization Act and Revenue Act of 1942 ushered in employer-sponsored third-party medical insurance payment. Two, Medicare and Medicaid were signed into law by President Johnson in 1965, complete with the prohibition of any federal interference clause that states, nothing in this title shall be construed to authorize any federal officer or employee to exercise any supervision or control over the selection or the manner in which medical services are provided, or over the selection, tenure, or compensation of an officer, employer, or any institution, agency, or person providing healthcare services. Government broke this promise. Our long retreat included losing ground to, among many things, RBRVS, HIPAA, CPT coding, ICD-10 diagnosis, meaningful use EHR, MACRA, and MIPS, a government scoring system imposed on physicians to penalize and reward them, reminiscent of China's citizen scores, a social engineering scheme imposed on the Chinese people by the Communist Party, both using big data to score people to control their behavior. In my first president's message, I lamented that we physicians have lost control of our profession, our patient safety, and our ability to freely practice patient-centered Hippocratic medicine in the United States. I advocated that it's time to take responsibility, not continue to be complicit in the destruction of the patient-physician relationship, the profession of medicine, and the entire US economy. It's our choice. But this goes further, beyond retreat. We surrendered our liberty and our ability to freely practice medicine the day they shut us down, and we said, okay, without a fight. Fittingly, that first national disaster declaration was made on Friday the 13th, March 2020, and the states followed suit. On Monday, March 16th, a national policy of 15 days to flatten the curve commenced and has never ended. It continues through today, 201 days and counting, with no end in sight. Under a disaster declaration, federal money becomes available to states that also have disaster declarations. Governor Abbott of Texas has signed monthly renewals of his disaster declaration. This not only allows him to access billions of federal dollars for Texas, but also allows him to unilaterally issue endless executive orders, including mandatory masking, closing businesses, restricting gatherings, and ceding his authority to city mayors and county judges, who can each then issue their own executive orders, further restricting personal freedoms and what were once unalienable rights. In my second president's message, I asked, do physicians now exist who are free to serve the sick and advance the field and the tradition of our visionaries, from the perspective of intellect, curiosity, and a deep-seated desire to find a solution for each individual patient and problem? Or will a team of population-focused, algorithm-following, shift-working mid-levels led by businessmen who profit from home death care and ethics professors who hope to die at 75, command us to just shut up, clock out, and send everyone to CVS with prescriptions for popular aid and drying drugs? Now I ask, do physicians exist who have courage? When I wrote that message in January, I had heard little of COVID-19. Today, in October, I have learned the answer the hard way. Little did I know that the dreaded team of population-focused, algorithm-following mid-levels, palliative care corporate profiteers, and bioethicists who specialize in rationing death and dying would be upstaged by power-hungry politicians and money-hungry bureaucrats whose orders and models would stop physicians from operating, stop medications from getting to patients, and lock Americans down in our homes, sending the US economy to a screeching halt and hurling our people to their knees. Because my goal is to deliver a message that offers hope and a solution, preparing this final message has been increasingly difficult. That fateful day in March, national, state, local, and organized medicine policymakers appointed themselves our overseers, citing CDC guidelines as marching orders by which to control us. In May, after 7 weeks of being prevented from operating on my patients under threat of jail for violating an executive order, fines, and possibly losing my medical license, I was finally allowed to return to the operating room for the first time in 7 weeks. Through the births of each of my 4 daughters, a severe fracture requiring 2 operations, breast cancer requiring 3 operations, and nearly losing a daughter after an accident that afflicted multi-organ trauma and then sepsis, I was never out of the OR for more than 3 weeks in my entire professional career. The blessing and privilege of being back in the clinic and OR always restores my sense of normalcy and purpose. I'm thankful for the 4 patients who mustered up the courage to have their surgery that first day back in the OR amid the flames of fear and panic permeating our society during this devastating COVID-19 pandemic and unprecedented response. At this moment, when our extraordinary scientific and technological capabilities are the most advanced in human history, why are we even in this situation? What broke and how can we fix it? Starting at the top, when faced with the reality that a deadly contagious coronavirus was already on US soil, President Trump called on our federal government's leaders in science, immunology, infectious disease, and epidemiology to direct our course of action and created a COVID-19 task force. The 2 dominant physicians, Drs. Anthony Fauci and Deborah Birx, were the professed experts on pandemic preparedness. Dr. Fauci is an immunologist who was appointed director of the National Institute of Allergy and Infectious Disease in 1984 and has served in that capacity under 6 presidents. Deborah Birx is an immunologist focused on HIV/AIDS vaccine research and global health, who's been with the Department of Defense since 1985, the CDC from 2005 to 14, and serves as U.S. Global AIDS Coordinator for the U.S. and Special Representative for Global Health Diplomacy. The NIAID is one of 27 institutes that make up the NIH. The NIH and the CDC are 2 of the 11 agencies of the Department of Health and Human Services. Drs. Fauci and Birx are entrenched government bureaucrats. Each is recognized for expertise in HIV and AIDS and vaccine research. But where's that AIDS vaccine? Fauci and Birx each serve to profit personally, as do other NIH, CDC, NIAID, and other HHS bureaucrats, private foundations, and private drug companies like Gilead, capitalizing on taxpayer-funded research when fruits of taxpayer-funded research and their patents pay off. When was the last time either one actually examined a patient? Despite their long tenures and lofty titles, COVID-19 seems to have caught them by surprise. In January 2017, at a conference on pandemic preparedness, Fauci himself warned his audience that there is no question that there will be a challenge to the coming Trump administration in the arena of infectious disease. Fauci's NIAID annual budget increased significantly from $4.9 billion in 2017 to $5.9 billion for 2020. Despite 36 years directing tens of billions of dollars and his own admonitions, he was not prepared, and he failed to have the United States prepared for this. The Fauci-Birx emergency response has not been much better. Their epidemiological computer models grossly overestimated the projected deaths from COVID-19, particularly on March 16th, when a report from Neil Ferguson's team at the Imperial College London produced death estimates of 2.2 million in the US. The Washington University Institute for Health Metrics and Evaluations model, on the other hand, projected around 135,000 deaths by August 4th, 94% fewer. And that was closer, reported as real life unfolded as about 147,000. Under the guise of acting in an abundance of caution, CDC, CMS, and other HHS agencies made recommendations and guidelines that were an effort to flatten the curve. The curve needed to be flattened because of New York City, one of the most densely populated cities in the world, a city that was unprepared and about to be overwhelmed. Ironically, the pandemic preparedness espoused by Fauci, a New Yorker himself, had fallen on leaders with deaf ears. All other states compassionately sacrificed to help New York through this crisis period, reallocating and rapidly manufacturing ventilators, personal protective equipment, pop-up hospitals, medications, manpower, and money. Every state is vastly different, but all went to bat for New York as one. Taking their cue from federal COVID-19 guidelines, individual states took action with governors firing off executive orders increasingly influenced by partisan politics and special interests. As a Texan, I was hopeful that faced with a pandemic of epic proportion, physicians would be granted greater freedom to make the best use of what we've got at hand to protect and treat our patients using our years of scientific pursuit, wisdom, experience, and pattern recognition. I'm currently a plaintiff suing the state of Texas, the Texas Medical Board and Texas Board of Pharmacy to remove the ban on physician dispensing. I sincerely believe this ban would be at least temporarily lifted to help patients get the physician-ordered medications they desperately needed during the COVID-19 lockdown. One would think physicians would be regarded as friends, not foes, when facing a highly contagious lethal virus. Ironically, the Texas Medical Board and Pharmacy Board, in out-of-control power grabs, instead completed the conversion of federal recommendations into state edicts by creating and adopting emergency rules based on Governor Abbott's executive order. The TMB and Texas Pharmacy Board emergency rules restricted physicians from operating in all but urgent or emergency cases and from writing prescriptions for the potentially prophylactic and therapeutic, time-tested, affordable, and available hydroxychloroquine without significant restrictions. The Texas Medical and Pharmacy Boards accused physicians of hoarding medications for themselves, when in fact it was the states who hoarded donations of these very medications from our national stockpile. Violation of the governor's executive order, replete with the TMB and Texas Pharmacy Board rules, came with the prospects of 180 days in jail, a $1,000 fine, restriction or suspension of your medical license, reporting to the National Practitioner Data Bank, mandated reporting, aka snitching, and no due process. The TMB aggressively pursued and continues to pursue surgeons and physicians who dared operate on their patients or prescribe hydroxychloroquine or perform antibody testing for their patients. 4 of these are my friends. I wonder how many more there are who struggle silently, ashamed. While their patients are grateful and doing beautifully, these physicians are targeted, guilty until proven innocent, forced to turn over private patient records and having to pay attorneys hefty fees to defend themselves for caring for their patients as they see fit. Some young physicians who took employed positions out of residency were let go. Hospitals were going bankrupt and patients were deteriorating, going without care. The unintended consequences far outweigh the consequences of the virus itself. As federal and state restrictions are eased, we still have county, city, workplace, and intimate interpersonal barriers with which to contend. As for me, I went to the office every day and took 2 weeks of call during a period when the American Academy of Ophthalmology sent out their own set of guidelines shaming us that we must only see emergency patients and only do emergency surgery or be guilty of spreading the plague like an Anopheles mosquito or flea on a rat. There were days when I saw only 2 or 3 patients, but I was there in case my services were needed by my patients. Many of my colleagues just closed their offices and stayed home. I kept all staff on the payroll, paid my overhead, and incurred debt. Like many private practice physicians, I did not take a paycheck for myself. Just as I was pondering the prudence of keeping my doors open during the second round, I received a Paycheck Protection Program loan. I had paid off all my debt, but suddenly, my government could send me to jail if I practiced my profession, if I dared to work for a living. 5 years after completely opting out of all third-party insurers, including Medicare, I found myself praying for a government loan, likening it to eminent domain. Never in my wildest dreams did I fathom the current state of affairs. Instead of being called upon during a pandemic as a physician and surgeon when I should be needed most, I had been trivialized, marginalized, demonized, politicized, criminalized, weaponized, leveraged, and controlled. Well, almost, were it not for AAPS, a consortium of trusted colleagues, worldwide access to scientific information and medical literature, my statesman, congressman, my family, my patients, freedom defending Americans, and the great physician himself. My hard-learned answer is yes. We still exist, but we're an endangered species. The threat of socialized and corporate medicine is a clear and present danger. But COVID-19 has revealed that we practice medicine one decision away from bankruptcy, loss of license, and jail. When we stood down, we let politicians and bureaucrats make medical policy and ended up with this never-ending lockdown, mandatory face masking, inability to congregate in groups of more than 10, even in our own home, closing public parks, playgrounds, beaches, inability to go to church, school, work, play sports, and on and on. So where's the hope and what's the solution? Becoming a physician requires traversing a rugged rite of passage. Not everyone has the requisites. Not everyone completes the journey. It's hard work, but hard work builds character, and what is hard-earned is worth fighting for. Those of us who made it through share those requisites, and we speak a shared language. We are the visionaries. We are connecting. We fight together. We must be courageous and do what is moral and in the best interest of our patients, even if our politicians say no. AAPS has our backs, leads us, stands beside us, and holds our hands when needed. We have the scientific and technological ability to beat this virus, and together with our minds united in morality, apolitical, unbought, and ungagged, we will find the antidote in short order. We must fight for our right to use what we have at hand now. We must not allow an abundance of caution on behalf of elected leaders to morph into a lack of common sense, or worse, acquiescence to loss of civil liberties and life itself. We must develop an immunity to fear, hysteria, panic, and politics. We must continue to commune, like revolutionaries conspiring in the town tavern against all odds until liberty or death. We are what broke. We let them pay for our education. We let them owe us. We let us owe them. We let them put us in networks, employ us, control us, threaten us, use us, shut us down. We let them stop us from dispensing, prescribing, operating, innovating, and thinking. We fix all this by putting minds over masks, patients over politics, freedom over fear, and God over government. And he said to them, doubtless you will quote me this proverb, physician, heal yourself, Luke 4:23. So stop selling our souls to third party. They cannot do anything without us, but we can do everything without them. We must denounce the AMA and other organized medical organizations which profit from the implement and comply, billing and coding, testing and certifying industries while lurching collectively towards single-payer socialized medicine. Embrace AAPS, which fights all for the patient and for you. Finally, the naysayers who say we will never be the same again are right. We must never let this happen again. Next time, we will be prepared. Physician in name only, such as Fauci and Birx, must go, and real-life physicians with boots on the ground must replace the bureaucrats with their patent-laden shoes. Now, here's the clincher. This will be hard. We're at war. Our army is good, but it is weak, decentralized, and has little money. Half of physicians are employed and fear reprisal. While most physicians agree on the problems, we disagree on the solutions. A growing number of us have just given up. We've accepted what third party has dished out and play the game. Many look to the AMA for new ways to code and bill and improve their MIPS scores. Many others support Medicare for all style socialized medicine, and more organized medicine groups are taking this approach. Some are leaving medicine altogether. Their army is strong, and there are nefarious forces at play on many fronts. They march lockstep and have lots of money. Money, power, and politics are strong drivers of bad behavior. Testing, tracing, treating, and reporting are big money industries. Governor Abbott spent $300 million federal dollars on contact tracing with a company called MTX. 17 states also started using technology from this same group. MTX has a $250 million contract with New York, plus a second one for $46 million for New York City alone. Testing and reporting and tracing are big money industries with potential for overreach, over-reporting, and error resulting in loss of liberty and livelihood for Americans. All of this money is coming from taxpayers, and none has gone towards actual treatment. We must stay vigilant and assure that data is meaningful, not a means of manipulation. How are they defining cases, infections? How are they testing? What are the PCR cycle thresholds? What is the occurrence and impact of false positive and false negatives? How are they defining hospitalizations and death? Why would someone want to inflate case counts? And what are the risks and benefits of doing so? As reported in Modern Healthcare, HHS was to send $10 billion in round 2 of relief grants to COVID-19 hotspots, hospitals that had more than 161 COVID-19 admissions between January 1st and June 10th, that's once for each day, will be paid $50,000 for each COVID-19 admission. Hospitals that use the new CDC and state society and territorial epidemiologist definition stand to make millions of dollars. In the first round of HHS grants, which was $12 billion, they paid $76,975 per admission to hospitals that had more than 100 COVID admissions. From January 1st through April 1st, obviously states that got early got huge sums of money. Illinois got $740 million, New York $684 million, Pennsylvania $655 million. Additionally, Medicaid will pay out $15 billion in relief funds. So the more cases, the better the return. Remember, this is on top of extra money commercial insurers pay and the extra 20% Medicare pays to hospitals for patients hospitalized with COVID-19. The hospitals reporting the most cases get the most money. Because of expanding the definition of new COVID-19 cases to exclude exposure to a COVID positive patient and a self-reported fever, lowering admission thresholds and requiring testing on every admission, it's easy to code a hospital admission as with COVID. A colleague of mine reported to me that her scheduled cesarean section patient was asymptomatic but tested positive on the required admission test. So she too became a hospitalization with COVID. The army of hospital billers and coders is no doubt hard at work scouring EMR and community contact tracing to find any links that could raise their bounty. Remember, doctors, nurses, and patient care staff do not get this money. In fact, many of our fellow physicians received pay cuts as great as 20% while being asked to step up and care for the increasing number of admissions. And many nurses and other members of our patient care teams were in fact fired or furloughed because of financial devastation resulting from the initial premature and prolonged shutdowns. Yes, thank and pray for our critical care doctors, nurses, and teams. They're doing more with less under great stress, but they're doing beautiful work. Death rates in Texas, for example, are remarkably low in spite of the new definitions of COVID-related death. And as discussed earlier, being coded does not require a test, but comes with a big payout for the hospitals. Definitions matter. And what are the consequences of our actions? We shut down without scientific evidence to back that decision. We have yet to see the full ramifications of that. We must look at the CDC all-cause excess deaths and distinguish actual deaths from COVID-19 from lockdown deaths, political theater, or panic deaths, if you will, deaths from overreaction to COVID. There's evidence that now that almost double the life years have been lost due to panic deaths versus COVID deaths, and that 112,000 excess deaths are not COVID caused. Deaths from delayed cancer care, overdose, suicide, addiction, abandonment, and abuse, Alzheimer's, and dementia are up, and we're living this. We are reaching the point that our policies are creating more death and destruction than the virus itself. The worst consequence of the inflated numbers and bad policy is that we are losing freedoms and destroying our state and country. Our reopenings are based on these numbers. We've lost our ability to congregate, go to church, school, weddings, funerals, go anywhere without a mask, hug our parents, grandparents, children, grandchildren, and the lonely. In Texas, our county covers 22 counties, but our case reports did not separate out who was a county resident and who was from another county. Ironically, While Bexar County is taking care of all the sickest patients transferred in, we're penalized because of increasing COVID-19 hospitalizations and deaths. Simultaneously, the counties that sent the patients to us record fewer COVID-19 admissions and deaths and remain open with greater freedom and liberty. San Antonio is not allowing us to gather in groups of more than 10, meetings of over 100, and events and meetings are being canceled. Some are being rescheduled to other counties that we cover. This inflicts severe economic and psychological damage on our community. As of last night, there were just 196 patients in the hospital with COVID in Bexar County, the center of a trauma service area that covers over 2.5 million people, 26,000 square miles, the 7th largest city in the country, and is but a 2-hour drive from Mexico. Yet we're restricted. Reopening our state is linked to indices, and our loss of liberty hinges on hospitalizations. Yet our policy rewards increased reporting of cases and admissions with COVID with more money. So we're effectively paying to keep ourselves locked down and afraid. Definitions matter, policy matters, ethics matter. This is not just a result of perverse financial incentives, but it's clearly also a political fight. San Antonio has a liberal mayor and Bexar County has a liberal county judge. Their approach is totalitarian. Their goal is for Democrats to win in November. Perhaps they are willing to draw this siege out to achieve personal political goals. Already, school openings have been delayed based on manipulated numbers. I've not discussed here the contemptible intellectual dishonesty, scientific fraud, and falsification of data that has been used to sabotage outpatient use of hydroxychloroquine and zinc in order to profit large drug and vaccine makers, such as those that make remdesivir. The trillions of dollars, billions of lives, and immeasurable conflicts of interest tying the CDC, FDA, NIH, and Dr. Fauci's NIAID into one giant tangle web are beyond the scope of this message. You must research this on your own. While some are inept, some are intentionally deceptive. Freedoms lost will never just be given back. We must take them back. Sadly, as exemplified by the attack on America's frontline doctors, physicians who speak out against this corruption are denigrated, censored, threatened, and fired. As more physicians become employees, they fear reprisal for speaking out in truth. AAPS is the only organization that has had physicians' backs and defended those who are threatened with loss of licensure by their state's medical board, fired by their hospital or private equity group, or worse. The rest of organized medicine is part of the problem and complicit in the take. COVID-19 is the 2020 weapon of mass destruction. This is bioterrorism resulting in the financial terrorism, economic devastation, and loss of American lives and liberty. Even our annual AAPS meeting could not be held in person due to government-imposed restrictions on public gatherings. The virus is bad, but the collateral damage from the failed response is worse. Everyone from Dr. Fauci to the media and half of our own profession wants to shut us down, but we must stand strong for our patients and posterity. It is we who must save the world or die trying. AAPS is the last best hope. Somehow, we must find a way to let all physicians and patients know that we are here for them. It has been my great pleasure to serve as AAPS president this year, a year no one expected. I'm humbled and blessed to have worked representing this tremendous organization. I want to acknowledge our dear friend, the late Jim Coy, and his years of service to APS, and who headed the nominating committee but died unexpectedly before my term as president, and Drs. Jordan and McDowell, as they step away but not apart, having literally devoted their lives to APS. Thank you, super doctor, superwoman, Dr. Jane Orient, tireless defender Andy Schlafly, Dr. Huntoon, and Jeremy Snavely, who is truly Superman. And to the board and membership of this incredible organization that does more for patients, physicians, and the patient-physician relationship than any organization in the US, if not the world. Genius and fearless Dr. Rob, Dr. Singleton, and countless AAPS members contributed invaluable research and courageous writing and fight during this siege. And thank you, my dear Texas colleagues and friends, Dr. Hughes and Page. I look forward to a great new year with Dr. Kempen as president and his mission for 2021. This very moment, the President of the United States is hospitalized fighting this virus. patent holders and bureaucrats at bedside, but so are our colleagues, physicians. Lord, I pray for perfect healing and complete recovery for our President Trump, that he can lead us out of this dark time into the future we have all envisioned, that you have envisioned, the future for which we must courageously fight. In the words of William Barrett Travis, to victory or death. In God we trust. Amen.